Hi, this week we will be discussing obsessive, compulsive, and related disorders. I am Dr. Meghan Dukes Rodriguez, and I am introducing my client Kiko Takahashi. Kiko is 82 years old, and her differential diagnosis is hoarding disorder. The primary diagnostic features are experiencing an inability to let go of possessions due to a perceived need, and the stress occurs when attempts are made to let go of objects. I ruled out post-traumatic stress disorder because Kiko's obsessions and compulsions are not evident by repeated and intrusive unwanted thoughts, impulses, or images that cause notable anxiety or distress. Rather, Kiko's story is that Kiko suffers from hoarding, which is as a result of the traumatic childhood experience. As a young girl, Kiko's life consisted of prominence, wealth, and privilege, residing in San Francisco, California. Kiko's carefree lifestyle changed overnight after her family was snatched out of San Francisco and placed in an internment camp in World War II. Kiko's family was robbed of all of their possessions of wealth and left with nothing. Kiko never again reached the status or standard of living that she enjoyed prior to the war as a young girl. As a result, Kiko's tendency is to hold on to possessions which most people would consider junk. The accumulation of worthless belongings collected over time and resulted in piled up trash, which prohibits anyone from seeing, let alone walking a clear path through Kiko's home. The garbage accumulation is a nesting ground for rats. Kiko's Japanese culture prevents her from seeing her son because she is humiliated and not worthy of his company, according to the Japanese culture. He honors her wishes, and although the health department has health code standards of which Kiko's home fails, the rats and rat droppings pose a real health hazard, and Kiko was ejected from her home as a result of the severity of the problem. She cannot return home until the house has been cleaned out. So her son took her to a motel where she resides today while he arranges to get the house cleaned up to health code standards. So Kiko comes for a psychological assessment reluctantly because she believes that her family's shame should remain private. She refuses to take any prescribed medication to help her deal with her issue of hoarding and is not willing to commit to any of the behavioral strategies that are suggested by the therapist to begin dealing with her issues. Multi-axial diagnosis for Kiko is Axis 1, hoarding disorder. Diagnostic criterion A is ongoing difficulty letting go of possessions regardless of their actual value. These symptoms for criterion A are evident when Kiko would hold on to things that the average person would consider trash. Her son found newspapers from as far back as the 1960s. Unfortunately, none of these papers that have been collected would be valuable to a collector or an item in any condition to sell to make any money. Diagnostic criterion B is difficulty discarding possessions is due to a supposed need to save the items to avoid stress associated with discarding the items. Symptoms for a criterion B are, in addition to the newspapers, Kiko had junk mail, old worn out clothing, old chewing gum wrappers, used cereal boxes, old children's toys, again in poor condition and therefore not viable for sale to a collector, just to name a few examples of the junk found in Kiko's home. Her son has tried to get her to get rid of this junk in her home, but bringing the subject up to her just resulted in her becoming so panicked and hysterical that he finally gave up pushing the issue. Diagnostic criterion C is that inability to discard possessions resulting in an accumulation of possessions that congest and clutter living areas and significantly interfere with the intended use of living areas. Symptoms for criterion C are met when the health inspector arrived at Kiko's house. He was shocked at what he's found. Kiko lives in a 2,800 square foot house, and the entire house was filled from floor to ceiling with stuff, with the exception of the kitchen, a small pathway from the kitchen to the bathroom, and a pathway from the bathroom to the bedroom, and the bedroom. Diagnostic criterion C, significant impairment or distress in normal functioning resulting from hoarding. Symptoms from criterion D are evident. Her son has tried to get her to get rid of the junk in her home, but bringing the subject up to her has resulted in becoming so panicked and hysterical that he finally gave up pushing the issues. He chose to deal with the issue by no longer coming to visit his mother and at her home. Diagnostic criterion E, hoarding is not due to another medical condition or better accounted by another mental disorder. Symptoms for criterion E, diagnosis is not due to another mental disorder. So axis 1, hoarding disorder. Axis 2, none. Axis 3, none. Axis 4, Kiko is a survivor of the World War II internment camps. The house is condemned by the health department. Axis 5, GAF is a 48. Theoretical perspectives are the socio-cultural perspective. Kiko suffered miserably as a Japanese youngster during World War II. The socio-cultural perspective attributes the development of psychological problems. Her family resided in the internment camp as prisoners of war. If a person lives in socio-cultural contexts in which challenging stressors exist requiring ongoing adaptation to survive, then the person is at greater risk of psychological problems developing. The government confiscated all of Nico's belongings when they uprooted her and her family, and as a result, she hoards possessions. Biological perspective. Operant conditioning is Kiko's faulty learning experience. She is positively reinforced when she engages in hoarding behavior in which collecting things makes her feel safe and secure, whereas Kiko is negatively reinforced when the anxiety when she is not able to hoard. Research has shown that the neurotransmitter dopamine may contribute to her hoarding behaviors. Because hoarding is a compulsive behavior, when engaged in it, it causes dopamine to be secreted. The secretion of dopamine results in the feelings of pleasure, thereby increasing the chance that Kiko will continue compulsively hoarding. By the accumulation of unvaluable belongings. When dopamine is secreted, a pleasure response happens, which increases the likelihood that would lead to the compulsive disorder. Abnormalities in the frontal cortex attached to possessions and poor insight. There's also deficits of serotonin. Lastly, the behavioral perspective. This client's symptoms may be due to irrational beliefs that Kiko would be safe from being taken and not lose anything again by reinforcing her hoarding behavior. Kiko developed hoarding disorder as a result of alleviating tension, anxiety, concern, and fear in her own life as a result of the trauma of experiencing World War II from the perception of a young Japanese girl. Kiko's series of traumatic losses led to ongoing fear of losing or letting go. Ongoing fear generalized to the fear of letting go of objects from her life. Holding on to things has served a purpose of protecting her from re-experiencing the pain from her past losses. The objects in her life, whether valuable or junk, became a surrogate for losses in her past. The faulty learning experience of operant conditioning with her hoarding behavior is being negatively reinforced. Each time she avoids letting go of her things, she also avoids feeling the pain, anxiety, and fear that results from letting go of her things. In addition, she may experience a sense of safety and security each time she views or interacts with her hoarded items, thereby being positively reinforced as well. That's it for hoarding disorder of obsessive compulsive and related disorders and our client Kiko Takahashi. Thank you.